Part B helps to cover doctor visits and ambulatory surgery, your ambulance and emergency room, outpatient labs, imaging and tests when you're doing it outside of the hospital. And this is one thing I want you to take away with you, covers infusion meds and chemotherapy. So even though we're talking about drugs, it falls under Part B. With the Advantage plans, you're going to work within the network. So obviously there's a geographic element to that. If you're on HMO, it's going to be doctors that they're going to look at your zip code. What are the doctors that are in your area, usually within a county or neighboring counties. Medigap plans are completely portable. So you can go to any doctor that you want to that accepts original Medicare, which is about 97% of them. And it doesn't matter if you want to go spend part of the year in Ohio and part of the year in Tennessee and part of the year here, you can do that. And you can go see a doctor anywhere that you want to. Maybe you found a specialist in Washington State. It's the only person that treats whatever it is that you've got a problem with. You can go see that specialist and take this with you, and it works there. What does Part A and B not cover? It doesn't cover prescription drugs. It doesn't cover dental, vision, and hearing. Now, it's routine dental, vision, and hearing. It does cover some procedures like cataract procedures, okay? It doesn't cover long-term and custodial care. So if you're counting on Medicare to help you with your nursing home, they're not going to be there for you. Custodial care, we should define that. That is activities of daily living, things like eating, bathing, getting dressed, stuff that we all have to do. Medicare doesn't help you with that kind of stuff. Now, they do cover some home health care, and we should make a distinction between home health care and home care, though. So home health care, when a nurse comes to your home and administers medications, changes your bandages, and then leaves. Home care, where someone who maybe looks like a nurse comes to your home and helps you to get around and check the mail and do the dishes and whatever else that you need, that's not covered by Medicare. But there are plans that help you with that sort of thing. If you've ever been a caregiver for someone, you know there's not enough of you to go around. Even if there's two of you, there's not enough of you to go around. Having someone come in for a few hours a day or even a few hours a week can be a lifesaver. And there are some really good plans out there that help to cover those types of things, but they're not Medicare. If you think that you're going to need something like that, talk to me. I'll have that conversation with you and help you with it. For the most part, Medicare does not help you outside of the United States. If you think about it, it's a federal program. Now, if you have a Plan G, there's some limited coverage outside of the United States. It's not bad. Emergency coverage within the first 60 days of being outside of the United States, they have a separate $250 deductible if you need that, and they'll cover up to $50,000 during your lifetime. If you're going on a cruise, get travel insurance. Lots of funny rules about being on a ship. If you're on Social Security, this $174.70 is probably going to get deducted from your Social Security check, and they do it quarterly, which comes as a surprise to people. Usually, the first time that they get that big 3 months taken out of their check at one time, they're like, whoa, what was that? What happened to my check? You can set it up on Easy Pay, though. I think they'll do a monthly draw from a bank account on Easy Pay. That's the Social Security word for we take the money straight from your account. Yeah, they can bill you for it. So if you're not taking Social Security yet, if you're one of those wise people that is postponing taking Social Security until you're 70 to max it out, then you can just pay it outside of Social Security. And I would suggest using Easy Pay, because anyone who does what I do could tell you a story of someone who said, oh, I don't want anybody taking money straight out of my account. I get it. I'm sort of old school too. But there are lots of stories about people who were in the hospital for more than 30 days and they didn't realize that bill was in the mailbox. Or maybe something happened. Maybe the bill got lost and it didn't get paid and their Part B lapses. And guess what happens when Part B lapses? Everything else unravels on you. Yeah. Remember, this is the apples in your Medicare pie here. You don't have apples in your Medicare pie, you don't have apple pie. So you need to keep that paid. Same thing with your Medigap premiums. You need to make sure that stays paid. Even on Easy Pay, it could happen, and I've seen it happen with somebody who changed banks and forgot to tell Medicare that they had changed banks and give them a new account number and routing number, and it lapsed that way. And he didn't realize it until he was months down the road. And boy, was that a mess. I don't know how he ever untangled it. Late enrollment penalties. Let's talk about that because all your friends are going to want to know about it. What's the scoop on late enrollment penalties? Part B has a late enrollment penalty of 10% for every year that you could have been enrolled in Medicare, but you weren't enrolled in Medicare. Now, here's how I see this come up most often. It's with veterans. So You get a veteran who turns 65 and says, I don't want to pay $175 a month. I have VA coverage and I'm healthy. I hardly ever use it anyway. A few years down the road, let's say 3 years for the sake of the story, he's complaining to one of his buddies about VA. And his buddy says, well, why don't you get Medicare? You're old enough to get Medicare. Because I didn't want to pay $175 a month. And he said, well, you don't like the VA, so why don't you go ahead and get on Medicare? So I get a call from the veteran. The veteran says, I'd like to get on Medicare. I say, sure, we can do that. It'll be $174.70 a month plus 30%, 3 times 10%. And in fact, it actually escalates over time because these premiums go up over time. So does the penalty with it. Let's talk about prescription drugs. Who's heard of a formulary? Anybody? A drug formulary. Yeah, there you go. So a formulary. So the best way to imagine what a formulary is think of it like a menu at a restaurant. Every Part D plan has a formulary. They all work the same way. It doesn't matter if you get your Part D coverage bundled with an Advantage plan or if you get a standalone Part D plan. They all work the same way. They all have a formulary. A formulary is very important because that tells you what's on the menu. So if you go to this restaurant over here, they may have chicken and shrimp and lobster. And if you go to this restaurant over here, they may have barbecue and steak and, I don't know, pizza. So they all have their own menus and they all have their own prices. Don't assume that your drugs are all in the formulary. In fact, only about 47% there's about 47% of prescription drugs are not included in Part D formulary. It's about 1 out of every 2 drugs is not covered by Part D at all. It's very important that you check that. Tier 1 is preferred generic drugs. Those are the ones when you go to get them filled, they have a $0 copay. Tier 2 is non-preferred generic drugs, and they might be a little more expensive. They might be $5. And then we get into the more expensive brand name drugs. Now these are drugs that might retail for $600 to $1,000, and you're paying $47 copay for those. It's not bad. Non-preferred brand name drugs are getting more expensive now. You're paying $100 or so. These are made up numbers, by the way. And then you get into the ultra expensive specialty drugs and they say, we're not going to do fixed copays anymore. You're just going to pay a percentage of the cost of the drug. So maybe you pay 25% of the cost of the drug, whatever that might be. So if you get a $10,000 drug, you're paying $2,500. They can get very, very expensive. All drug plans have a formulary. So all drug plans also have phases. And what we're looking at right here is an illustration of how things are in 2024. There are 4 phases. The first phase begins January 1st or when you enroll in the plan, and that's the deductible phase. Now, you'll know you're in the deductible phase because you're paying 100% of the cost of the drugs until you reach your deductible. Whatever your deductible is. I put $545 up here because that's the most common deductible in 2024. So $545 is the most common deductible. It is possible that you could have a plan that has a lower deductible. I've seen them with a $150 deductible. I've seen them with a $0 deductible. But usually when you have a lower deductible, you have higher premiums. Basic rule of insurance is if they're giving you something with one hand, they're taking away something with the other hand. So once you reach your deductible, you're going to move over into the second phase. So that's the initial coverage phase. And that's where all of these co-payments apply. That's where most people spend their time. Now, if you're having a really bad year and your total drug cost for the year at some point reach $5,030, then you're going to tip over into the third phase. That's called the coverage gap, also known as the donut hole. When you're older and you're on prescription drugs, you'll know about the donut hole. Okay. Why do they call it the donut hole? We don't know, but it changes the rules. All of these copays go away, and you're now going to pay 25% of the cost of the drug. Only 25% of the cost of the drug that got you into the donut hole, but 25% of the cost of all of your drugs. It's going to bring all of your prescriptions with it. Let me give you a scenario of how this could play out. Let's say that you've got one of these preferred brand name drugs that retails for $1,000 a month. So in the first month, you show up, you have to pay $545 out of pocket for your deductible, and the insurance company picks up the rest. In the second month, it's $1,000, $1,000, $1,000, $1,000, and about midway through the year, during the summer, you finally reach $5,030 and you tip over into the donut hole. Well, the whole time you've been paying $47 copays. And when you tip over into the donut hole, you show up at the pharmacy and they say, that will be $250 for you today. And you're like, whoa, what happened? I was paying $47 for it. Well, it's because you're in the donut hole now. So if you're having a really bad year and your total drug costs finally reach $8,000 for the year, now that's not how much you're paying. This is how much you're paying plus your insurance company, but it's the total cost of your drugs. You reach $8,000, then you're going to be in the catastrophic phase. Sounds terrible, doesn't it? It's really not that bad, because at that point, the insurance company is going to take over paying everything beyond that. So that's as bad as it can get. And really, it's not that bad, because your part of that $8,000 is probably something around $3,500. So if you're working with me, then in the fall, during an annual election period between October the 15th and December the 7th, that's the time that you change it, I'm going to call you up and I'm going to say, hey, how are you doing? How's your plan working out? Do you have any new prescriptions? Do you have any that you dropped? Anything new? Let's check and make sure that the plan that you're on is still the best thing for you. And if not, then let's look at next year's plans and let's see if there's something that's better for you. And you're going to have the peace of mind of knowing that you've got the best thing for you. Because I can tell you that this is a really complex thing to try to figure out on your own. And we have software that we can put all of your drugs into. And we put in your zip code, and it shows us all the plans that are available in your zip code. And all of these moving parts like deductibles and co-payments and all of that. So even how often that you buy your drugs and what pharmacies that you buy your drugs from, we can factor in all of that stuff, and it models it out over the course of a year. So I could share my computer screen with you and let you see it side by side, and you can make a choice of what's best for you instead of just taking my word for it that that's what you ought to be on. But you definitely don't want to just set it and forget it when it comes to prescription drug plans. Have you heard of the Inflation Reduction Act? If Washington, D.C., somebody in Washington, D.C. says, we are doing this, it's probably not doing that. Medicare plan.